Hello guys, welcome back to my lessons. Today we're doing endocrine glands part 4 and this is the second last lesson. So today we'll be talking about adrenal gland. Remember I introduced you to homeostasis as well as negative feedback mechanism. By now you need to know what they are and what they have to do with these glands and hormones, how these glands and hormones work together to maintain the internal environment of a human body. So today we're going to talk about the gland, adrenal gland. Then from there we are done with the glands. We're going to do the last part where we're going to do this other two negative feedback mechanisms, but they don't have to do with, there are no hormones secreted there. So today we're going to talk about adrenal gland, which secretes two hormones just like the pancreas. Remember, the pancreas secretes the glucagon and the insulin. Today we're going to talk about adrenaline and aldosterone. Adrenal gland secretes adrenaline and aldosterone. So let's first look at adrenaline. This one does not have a negative feedback mechanism, but they will ask you what happens. They can just give you a scenario when a person is scared. Adrenaline is secreted into the blood. Now they would want to know the functions of adrenaline. What happens is adrenaline increases heartbeat, it increases blood pressure, it increases conversion from glycogen to glucose, blood supply to the cardiac and skeletal muscles, skeletal muscle tone, rate and depth of breathing, diameter of pupils. It decreases blood flow to the digestive system and the skin. So if they ask you the function of adrenaline, this is what you should write, all the points. Let's move to aldosterone. Aldosterone, it targets the organ kidney. It regulates the salt concentration in the blood. Now let's look at what happens when the salt level in the blood decreases. The receptor cells in the afferent and the efferent arterioles of the kidney detect the low salt level. The adrenal gland is stimulated into secreting more aldosterone. Aldosterone increases the reabsorption of the sodium ions from the renal tubules of the kidney into the surrounding blood vessels. The salt level in the blood vessels increases and returns back to normal. Now, what happens when the salt level in the blood increases? The salt level in the blood, when it increases, the receptor cells in the afferent and the efferent arterioles of the kidney detect the high salt level. The adrenal gland is stimulated to stop secreting aldosterone to secrete less aldosterone. This decreases the reabsorption of sodium ions from the renal tubules in the kidney into the surrounding blood vessels. The salt level in the blood vessels decreases and returns back to normal. So now if you can't cram these long sentences, you can just use this table and construct your own small sentences.